Knock.
Hello.
Hi, my name is Samuel. I'm a student nurse. I'm going to be your nurse and conducting your physical examination for neuro. Can you tell me your name and date of birth?
My name is Patrick Grady. My date of birth is 17th July 1978.
Can you tell me where you are right now?
I'm in the clinic.
And then why are you here?
I'm here for my annual physical.
Okay, the patient is oriented times 4. He knows where he is, and he looks well groomed, and he has no obvious physical distress. So, according to your record, it shows that you are 5'2". Is that correct?
Correct.
And then you are 180 pounds?
Yes, sir.
Okay, so from his record, I can see his vitals. His blood pressure is 120/80. His respiratory rate is 16 breaths per minute. His heart rate is about 65. It seems like he's healthy. And his temperature is 98.2 Fahrenheit. So now I'm going to start with the head, and then I'm going to just follow my prompt. I'm going to inspect the patient's head. I see the skin. There's no discoloration, and his head is normocephalic and is symmetrical on both sides. I'm going to palpate your temporal pulses. Temporal pulses are active and stable and equal on both sides. Temporal mandibular joint. Can you open them up? Can you do like this? Do you feel anything?
No, sir.
Okay. And then, so now, cranial nerve. I'm going to test for cranial nerve 7.
Okay.
Can you smile for me? Can you puff your cheeks? And can you raise your eyebrows? Now, I'm going to test you with this in very light. If you feel, just nod your head.
Okay.
All right, the patient's cranial nerve 7 is intact. And then I'm going to check his eyes. So, sir, do you wear contact lenses?
No, sir.
Do you wear any reading glasses?
No, sir.
Okay, so I'm testing for cranial nerve 2. So can you, with both eyes, can you read the tail line?
3748.
Okay, can you close the right eye and read it?
3748.
Can you close your left eye and read the fourth line?
983 M 3W 00X or OOX 1410.
All right, thank you. From what I see, the patient has a vision of 20/20 with no glasses, and then his cranial nerve 2 is intact. Now I'm gonna try to wave my hand. When you see my fingers, just nod.
Yes, sir.
All right. So I'm gonna check the patient's ocular motors, the extraocular. Yeah, just check peripheral visions. So I'm going to do extraocular muscles. So just follow only your eyes. Don't move your head. Just follow the pen. So this test text for cranial nerves 3, 4, and 6. As you can see, all the patient's cranial nerves are intact. And I'm not going to check for the patient's eyelid. I'm going to pull the eyelid down. Look at the cornea. So the eyelid is non-congested and it's not red. And the cornea is evenly colored. The iris is evenly colored, and the cornea has no cloudiness. So now I'm going to use the light to check the patient's peripheral vision, the pupil size and everything. So I'm going to turn the light off quickly. So use the pen light. And while the room is still dark, I'm going to check for the red reflex. So I'm going to use and I can see the red reflect in the patient's eye is positive for red reflex. I'm going to hurriedly turn back the light on. I'm going to check the patient's diameter of the pupils. It's about 3 millimeters in size and equal on both sides. So the patient's pupils are round, they're equal and they're reactive with light. I'm going to test for accommodation. So can you fix the eyelid and look over my shoulder? Can you look at this? So the patient is able to focus on near and distant objects. So his accommodation is in place. Now I'm going to look at the patient's ears. Inspecting the patient's ears. The patient's ears are equal on both sides. I don't see any redness. I don't see any drainage coming from the patient's ears. The skin. I'm going to whisper in the patient's ear. He's going to repeat what I said. Low tremor.
No tremor. $50 billion.
All right, so the patient can hear in both ears. So now I'm going to perform the Rene and Weber test. So I'm going to strike this the tuning fork and then place it on top of the patient's head for a Weber. And the patient will be able to tell me whether he can hear in both ears and then feel the vibration. One more time. Can you hear in both ears? And I'm going to do the Rene test. This time I'm going to place the tuning fork on the mystoid bone. And then the patient will tell me whether he can hear it in his ear and then feel it when it stops.
Yes.
You feel the vibration when it stops?
Yes.
Try the other ear.
Yes.
Okay, you feel it when it stops. Now I'm going to use the otoscope to view the patient's ears to see. I'm going to inspect the tympanic membrane to see whether there's any redness or drainage or any inconsistency. Patient's tympanic membrane is clear, no redness and no inconsistency. I'm going to inspect the patient's nose. I'm going to use the pen light. I'm just looking at the patient's nose. All right. I see it's pink. The mucous membrane is pink. There's no drainage coming out of it. And I'm going to palpate the frontal sinus and the maxillary sinus. Do you feel anything?
No, sir.
No pain. I'm going to inspect the mouth and the throat. So, can you open your mouth for me? Can you say ah? Okay, good. I don't have a tongue depressor, so I'm just going to open the tongue. The patient dentation is good. Dentation is good. The oral mucosa are pink, and the patient has no swelling, and all of his teeth are intact. So next thing I'm going to do, I'm going to inspect the tongue. Can you one more time? The tongue is midline, and there's no swelling on the tongue. Well, the uvula is midline. The uvula was midline, so okay. Next, I'm gonna do. So when the patient said, I was testing cranial nerve 9 and 10, and he stick out the tongue and just said, Good job, thank you very much. Can you move it up and down? So it moves up and down from side to side. The cranial nerve 9 and 10 are intact. And then I move on very quickly to the neck. I'm just gonna inspect the neck. Yeah. Can you move your neck sideways for me? Can you move it sideways? That's lateral rotation. Can you flex your neck and bring it in? Yeah. Can you extend your neck? Do you feel any pain?
No,
Do you
sir.
experience any limitations?
No, sir.
So the patient has no limitation in the movement of his neck, and I'm going to palpate the carotid arteries. So I'm going to do it one at a time because I cannot do both to check for the carotid pulses. So if it is palpable, it's non-bounding. And test the left side. So the patient has no evidence of brewing there +2. And I'm just going to auscultate now the carotid. Get this ready. All right, so yes. Yeah, so there's no evidence of bruise. And I'll move on next to do to auscultate the lymph nodes in the neck. So I'm going to start with the preauricular, the postauricular, the occipital, the superficial clavicle, and then the posterior clavicle, and then I'll do the anterior clavicle, and then the tonsillar clavicle. Do you feel? Is a submental clavicle and submandibular, and then the supraclavicular clavicle. Some water. So after palpating the lymph nodes, there's no evidence of any lump and any abnormality and firmness in the lymph node. There's nothing enlarged. And now I'm going to go to the thyroid. I'm going to palpate the thyroid gland. Any pain?
No, sir.
No pain. So there's no enlargement of the thyroid gland, and there are no masses in the thyroid gland. And now, so we'll move on next to the upper extremity. I'm going to do a palpation of these are the nodes I'm going to palpate under the arm. So can you lift your hand? Yeah. So this is as I palpate the lateral nodes. These are central nodes, subposterior nodes, and these are lateral nodes once again, and then axillary nodes. And I feel no enlargement, no deformities, or any kind of hardness of thing. So next I go on to palpate the shoulders. Do you feel any pain?
No, sir.
Okay. Can you put your hand behind this? Putting his hand behind his head is a shorter range of motion. He's this is a external rotation. Can you put your hand at the back of the head? This is a internal rotation. The shoulder shows a full range of motion. Can you go like this? Bring your hand back. Okay. Can you bring it back? Do you feel any pain?
No, sir.
No pains. Okay. So the patient has no pains in the shoulder, and he has a full range of motion. Now, next step I'm going to do is I'm going to test for cranial nerve 11. I'm going to ask the patient to shrug his shoulder. Can you shrug your shoulder? As you can see in the video, the patient can shrug his shoulders without any limitations, and he's doing it with ease. And next, I go on to the elbows. I'm going to palpate the elbows. pain?
No, sir.
All right, can you, that's for flexion of the elbow, extending of the elbow, and can you internal rotation of the elbow and external rotation of the elbow. Well, so the patient has no kind of limited range of motion. He can do all of these things with ease, and he has no difficulty or pain. Now I'm going to palpate the radial pulses. Radial pulse is palpable and is +2, the normal limit. And next I move on to now go see, can you grab my fingers? I'm testing for grip strength. Try that again. So the patient has a grip strength that's equal on both sides. And next I go to auscultate the lungs and the cardiac functions. So I just like to do this. I know you have the gown on, so I cannot see your bare chest. To look. Just observe inspect the chest wall. The chest wall is equal bilateral movement on both sides, and I don't see any kind of thing on the back. So the chest wall is symmetrical and bilaterally symmetrical. And next, I'm going to palpate for crepitus. I'm going to place my hands on the patient's back and ask the patient to say the word 99, and I'll be checking to see if when he said 99, whether the vibration is going to be equal as I touch his back. Can you say 99?
99. 99.
One more time.
99.
Okay, so the patients there are no popping signs, there are no crepitus when I touch the patient's back. The next thing we're going to do is I'm going to check the patient's capillary refill. You see, so I'll start with the thumb, both thumbs. Capillary refill is less than 3 seconds, and I'll just check, yeah. So capillary refill is less than 3 seconds. So he has pulse and he has good capillary refill. And next I'm going to do auscultate the patient's posterior. Can you lie that on your back? So I'm gonna do auscultation in 4 regions. I'm gonna start with the right lower quadrant. So as I listen to the patient's lung sound, there's no evidence of adventitious sounds, no crackles, no wheezes. So I'm going to, can you say that for me? Yeah, you good. So I'm going to lie down on your stomach. I'm going to do the posterior lung. Can you take a deep breath? Again. All right, thank you. So again, as I said, there are no adventitious sounds, no long crackles or wheezes. Now I'm going to auscultate the patient's the apical points on his chest, what we call abdomen. I'm going to check his heart rate. I'm going to start first with the aortic. Right? I'm going to listen for at least a few seconds. And I'm going to go on to the pulmonic. and I'm now auscultating Erb's point. I'm down to the tricuspid valve. And now I'm auscultating the mitral valve. Right. So upon auscultations, all points show a regular rate and rhythm without any murmur. Now my next step is I have to go to the abdomen. So I'm just going to inspect the abdomen. Could you lie them by so I can inspect the abdomen? Is it possible to take off the shirt to see? Yeah. The skin is no discoloration on the skin. The patient's umbilicus is symmetrical and even in color. There is no evidence of distension, and the belly button is midline and at the level of the hips. Thank you so much. You mean to say that? I know this must be something like fun. So I'm gonna make you go back, and then I'm gonna auscultate valve sound. Okay. So now I'm gonna auscultate the valve sounds. So as I've previously done this, now I'm going to auscultate for the vascular sound. So I'm going to switch from the diaphragm to the bell of my stethoscope, and I will start at the points above the umbilicus. First is the aortic. I'm going to listen for a few seconds. And then the left renal artery. I'm still on the left renal artery. The right iliac artery. And then the right iliac artery this time. The femoral artery and the right femoral artery. All right, just remain in position. So, upon auscultations, there are no signs of bruise, which is very important. You didn't have bruise. Oh, sorry. Now I'm going to percuss. And when I percussing, I'm going to be looking for a hollow sound, which is going to be unexpected finding. So I'm going to start in this quadrant. Yeah. So there's a hollow sound in all 4 quadrants. And I'm going to do next is go on to light palpation. So I have to start light before I can go deep so I don't displace any organs. You feel anything?
No. No. Don't. No.
And I'm going to go deep.
No. 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 No.
So the patient's abdomen is soft, and there are no signs of guarding, pain, or tenderness. So you may say it up. Now we go next to the lower extremities. I'm going to palpate the patient's hip, but I'm thinking whether to go while he's sitting or standing. So I'm just going to palpate the I would rather you stand up for me. Yeah, so that at least I will be over there. So here I'm palpating the iliac crest, the superior iliac crest for pain, the spine. And I'm going to do this on the other side. So the crest, the iliac crest, the spine, and the inferior iliac crest. The greater trochanter as well, and the ischial tuberosity. Do you have any tenderness? Do you feel any tenderness? No. No pain, no tenderness in any area? No. Okay. Now, we're going to test your hip range of motion.
Okay.
Can you flex this way? Okay. Yeah, no, just flex. Just leave it. Can you extend it backwards? All right. I want you to watch me. I want you to take your foot and do this way. Okay, do the other leg. Oh, that's good. That's for abduction. And can you do bring it in, right? And do the other one. That's testing for adduction of the patient is able to do this. It's full range of motion with no signs of pain and any difficulties. So let me see. Next, we'll move on to the knee. Inspecting the knee. I'm just gonna palpate and see whether I can feel any kind of edema. And there's no edema. Even though I cannot see the patient's knee is not fully exposed, but from palpating I can see that it's bilaterally symmetrical. And I don't think the skin is intact. And considering the patient, I don't think I'm just gonna take a look. His legs are his pants are too tight, so I'm not gonna raise his pants. Yeah, so okay. Can you lay back on prone?
Prone?
Yes. No, just lay back. Yeah, supine. Okay. Come up a little bit closer. Can you flex your knee? Can you bring your knee up? Can you down? Let's go. Can you bring your knee up? Bring it down. Okay. And yeah, see, he's extend. He can extend his knee and flex his knee. I'm going to check for. So I'm just going to pull on the patient's knee as I'm doing the drawer text. I'm checking for laxity to see whether there are any kind of weak muscles in the patient's knees. Do you feel any kind of pain? I don't feel any. That's the drawer test. So for testing the anterior ligament as well, so there is no laxity in either knee. So next, I'll move on to the patient's ankle. I'm going to inspect for his ankle and his feet. I just sit up. I'm going to look at the patient's ankle and feet to see. I don't see any kind of edema, no sign in the feet and ankle. Bilateral, there are no edema. And next, I'm going to feel for your pulses, the pedal pulses. The pedal pulses in both legs they're palpable, and then they're about a +2, and they're present in both legs. And while I'm down here, I'm going to ask the patient to do a plantar flexion and dorsiflexion. Can you press down like you press on the gas? Okay, can you? So the patients are both sides are equal and they display full strength at maybe, let's say, roughly a 5. And I'm going to bring my paper again to see whether I can test the patients. If the patient can sense any kind of light touch in both. So I'm just going to raise the paper a little bit, give it a very light.
Yes.
You feel it?
Yes.
Okay, so, well, the patient has the light touch, so no tingling and numbness in both legs. Next time we'll move on to, I'm not going to get a sip of water in the meantime. While I'm staying on this, I'm going to check the patient's patella. This is the bicep. So this is the patella, right? Do you feel any pain in your patella?
No.
Okay, so positive reflex. And so now I've just palpated the patient's back, and I'm going to check for reflex. So when I test the patients with this thing, he should have a knee-jerk reaction. Okay. As you can see, it's bilateral in both arm. And then I'm going to try to do the upper extremity and check the biceps. So the same reaction, I'm just going to hit this place and then see how he reacts. Okay. So the patient's reflexes are equal on both sides. And next, I'm going to try to do, I'm going to try to write in the patient's hand and see whether he can sense that. And there's a function where he can see, he can feel it on both sides. I'm going to draw a letter with the patient not looking and see what that would be. So,
4. 4.
okay. So the patients have the graphic testing for graphithesis in both hands is equal and bilateral. Now I'm going to do something asking the patient to do alternating movements. I want you to watch me when you alternate. Okay, it's fast, rapid. Okay, so the upper and lower extremity, he has movement is smooth. The patient does have coordination to do rapid motion in both extremities. So, and the next thing I'm going to test the patient on is to see a point-to-point test. I'm going to ask the patient to touch. I'm going to put my finger to the patient and ask him to touch my finger and then touch his nose. And I'm going to move it to the other side and the other side. Can you do it with the next hand? All right, so the patient was able to perform this test and it's indicated proper coordination with no signs of neurological problem. All right, the next thing I want to do is to check, inspect the patient's spinal cord. I'll ask the patient to stand. So I'm going to go at the back of the patient and see. I'm going to inspect. There is no curvature, and the patient has no thoracic or he has no cervical curvature. If he were to have any of these, it would be a sign either he has a lordosis, kyphosis, or the patient has some kind of malfunction in his back. So there's nothing here. The patient has his back is straight and his spine looks intact. Now I'm going to do the movement of the spine to see whether he can flex. So can you face me, please? Now I'm going to ask the patient to flex downward. Can you go downward? Okay. Can you go backwards? Can you move both sides? This, that. Okay, good. So as you can see, the patient has he can flex, he can extend, and the patient can bend forward. He has yeah, so the patient has a full range in the spine. There's no evidence of any pain or abnormality. The next thing I'm going to do is I'm going to test the patient's balance. I'm going to ask the patient to hop on one leg like me. Can you do that? Can you go to know the next foot? So as the patient is hopping on one leg to see that there are no issues with balance. That's the reason I'm making you do this test. Just want you to sit back down. And the next test I would do for the patient is I would do the pronatal drift. This test is going to be, I'm going to ask the patient to close his eyes. Can you close your eyes? And can you put out your hands? So I'm going to wait for a few seconds to see if the patient hand does not involuntarily calm down. It means that he's negative for a pronatal drift. So after a few seconds, the patient's hands are still up, so the patient is negative for pronatal drift, and that's good. The next thing, the last but not the least, I'm going to ask the patient to do the Rumberg test. I'm going to ask the patient to close his eyes for at least 20 seconds. I hope time is permitting me to do that. and then we see whether the person, if he has, we're testing his balance with his eyes closed to see whether the patient has a balance. So can you close your eyes and then for 20 seconds? Okay, so as you can see, the patient was steady. He didn't sway. He didn't do anything. This indicate that the patient is negative for a Romberg test. Thank you so much. You may sit. So I've come to the end of my examination. I'm going to report to the provider my findings, and I hope you have a nice time and we're able to treat you well. Thank you so much, sir. So now I'm going to do my hand hygiene. And that's the thank you so much.